A security guard has been punched in the face and hospitalised after yet another assault at Hillmorton Hospital. The hospital has dominated news headlines recently as the number of serious assaults on nurses has reached a tipping point. At the request of senior staff, the Canterbury DHB met with mental health nurses on Monday and again today. The DHB also met with WorkSafe New Zealand yesterday. But this morning, Checkpoint understands a security guard on site was punched in the face during a brawl just before 10 o'clock this morning. Both St John and the police attended. Sadly, this is not a new problem. Checkpoint has been reporting on nurse assaults for a long time. We've heard about nurses in the adult acute inpatient unit who have been dragged across the floor, strangled, punched, and most recently burnt and stabbed. We've had nurses tell us they go to work in fear for their lives. They say management is well aware of what's gone on, but no big changes have been made. We have been requesting interviews with senior management on this for months, but that has always been refused until now. We're about to go live to Hillmorton and speak with Chief Executive David Mates, but first our South Island reporter Logan Church recaps what we know so far. And just a warning, if you are watching, the pictures we are about to show are very graphic.
So I know nurses who will go and buy patients cigarettes and buy them food out of their own pockets so that they'll feel safe at work.
That's a Hillmorton nurse speaking to Checkpoint earlier this year. They described to us their living hell, a workplace where getting punched or hit is the norm. This nurse, and the many others Checkpoint have spoken to, have simply had enough.
There's an underlying fear among nurses and acutes that it's going to take someone dying before something is done about this. And even then, I'll have my reserves about whether that would be enough.
Some nurses have posted pictures on Facebook of horrific injuries they've received at the hands of their patients. They show bloody, destroyed nails, cuts and burns. The worst assaults seem to take place at the adult acute inpatient unit, but other parts of the hospital, forensic services, AT&R, we're told are just as challenging. In several statements we've received from the Canterbury DHB, it's pointed to an increased demand on these services following the Canterbury earthquakes. It's a given fact this city has truly terrifying mental health statistics, but for this hospital, staff assaults are nothing new and go beyond the earthquakes. Here is audio from Checkpoint 18 years ago, when this hospital was known as Sunnyside.
An investigation is underway into a series of patient assaults on nurses at Sunnyside Psychiatric Hospital in Christchurch, the most recent of which has left a nurse in hospital for more than a week with head injuries. She's the fourth nurse to be attacked during the last few months. Now an occupational safety and health task force is to look at the incidents and determine how to improve safety at Sunnyside. Last week, Sunnyside Hospital Management told Radio New Zealand that...
So what's changed? Fast forward almost 2 decades. The Canterbury DHB held a meeting with about 50 nurses this week, following a stabbing and boiling water attack last week. It described the meeting as open and honest, but some of the nurses who attended told Checkpoint it was more tense and angry. Those nurses left Monday's meeting frustrated that no commitments to any immediate fixes were promised. And that leads us to right now, in the admin block of Hillmorton Hospital, where I'm sitting in a room with the DHB's Chief Executive, David Mates, as well as other senior managers. It's taken months and months of requests for these managers to agree to an interview. The nurses we're speaking to are too afraid of the managers here with me to speak out publicly on Checkpoint. But they say what they do want to know from the DHB right now is what it is doing to ensure that when they go to work next, they don't leave their shift in the back of an ambulance or in a body bag.
And the Canterbury DHB's Chief Executive, David Mates, now joins us live on the phone from Hillmorton Hospital following another meeting today with nurses. Good evening, Mr Mates. What are you doing to make sure that no nurse leaves Hillmorton in the back of an ambulance or in a body bag?
Good evening. I think, first of all, what we have seen is a significant uplift of serious assaults, particularly over the past few weeks. That's not to say there have not been a range of other assaults over a long period of time. One of the core elements that the mental health services continue to really struggle with is they're in total dealing with 100 or twice as many patients as what they were doing before the earthquakes. And the challenge with that in a really constrained physical environment is not conducive to both appropriate care.
So what are you doing? What are you doing now to make sure they are safe?
So what we have added to the 3 security guards on site is that we've got another 2 that are going in on a 24 hours, 7 days a week, that are working in the adult unit and under the direction of nursing. Now, one of the things, there's been a lot of debate about the appropriateness of security guards because often they are not able to help de-escalate. So the positions that we're putting into place are very much geared about how to work with nursing to help de-escalate situations.
So at any given time, I'm sorry to interrupt, I just want to clarify this. At any given time, how many security officers will be rostered on in this acute ward?
So in terms of the site, there have been 3, and there are further 2. And those 2 will be focused within the adult inpatient services. 2
at all times or 5 at all times? You're not being clear on that.
2 at all times within the adult unit, and that's a total of 5 across the mental health campus at Hillmorton.
Okay, what concerns did the nurses raise today with you in that meeting? What did they tell you?
So, kind of a range of concerns. One, kind of in terms of, personal safety. Also, concerns about the responsiveness and how we engage with our partners, and particularly the police, which we are working very quickly and very closely with to get some communication protocols agreed between the 2 of us.
How would you describe the tone of that meeting?
The tone of the meeting, I think on Monday you would describe it as kind of very tense, and people really very clearly expressing a range of views. Today there's around about 90 staff, really thoughtful, and a range of suggestions and recommendations sitting within, kind of coming out of that meeting.
Because the nurses are telling us that management, and that includes you, are out of touch. Are you out of touch with what's going on and their feelings?
No, we're actually very clear about what has been happening. Again, across a mental health service, and just to put that into context, there's about 1,200 staff involved in the mental health services, and there's a range, and quite a wide range of different views and perspectives about both solutions, options, and choices. And that is something that we're continuing to work with teams and the unions about actually what changes or modifications to the model of care that are going to be required, with the understanding that actually we have a range of facilities that are no longer fit for purpose and are not of the right size to deal with the patient size and demands that we're providing care for.
How long have you known that you've got a serious problem there with staff injuries? How long?
So in terms of what we've seen in particularly the last few weeks...
Yes, but you described that as an escalation. So when did you first know that you had problems?
So in the last 2 months, there have been 5 serious assaults, and again, you referred to one that happened this morning, which is while I was on site at Hillmorton. And what the nature of those assaults has been the involvement of weapons sitting within that. And there does seem to be, and expressed from a range of staff today, concern about inaccuracies of media reporting in terms of actually helping to escalate or changing the social licence of those accessing services, feeling as though they can assault staff.
Mr.
Now,
Mates,
assaulting staff is never okay.
Mr. Mates, you talk about the last couple of months, but if we look at the track record for that hospital, you've had almost 200 ACC cases over the past 5 years, paying out hundreds of thousands of dollars. A WorkSafe incident register shows a serious incident in August of 2015, someone who fractured a leg while trying to calm and restrain a patient. And it's taken you quite a while to front up on this issue. Have you done enough fast enough?
So in terms of the ACC kind of claims, they've been over a long period of time. A core driver for those have actually come from the intellectual disability services, And in terms of particularly the facility environments that have caused and created a environment where there have been a number of serious staff harms. Part of that is actually there's a $5.5 million alteration to a facility that has been approved that is going to take it'll be 18 months before that is built.
And that's
that is
the point, isn't
deal
it?
with that.
That is the point. It's 18 months to 2 years away. So in the here and now, besides 2 extra security guards, what are you doing to keep your staff safe?
So what we're working with is we've got a 6 to 8 bed community acute inpatient unit that is coming on live the end of February, early March 2019. That has been in the planning, which was deliberately developed to try and take the patient numbers out of an overflowing inpatient unit. That is something we've been working with the union and staff for a long period of time in terms of a deliberate strategy to get patient numbers down. So that comes into place in February, the end of March.
All right, so 3 months away. What about WorkSafe? Yes. What have they told you at the meeting they had about how you've been dealing with this?
So WorkSafe, we have, since March of this year, we have made, as an organisation, 11 notifications to them, of which 5 were from mental health, and there's another 3 to go. We have received confirmation back on each of those that there will be no further investigation.
Yeah, but they've told you to pull your socks up, haven't they? Because they said that your risk management was not at an acceptable level.
So the interesting bit in terms of actually, no, they haven't said that to us.
What, they haven't said your risk management is not at an acceptable level?
No, it's not. That's absolutely right. They have not said that to us.
They've said that to the media, though, Mr. Mates.
Yes, no, I understand they've said that to the media, and it was really curious that they could make a statement like that without actually having engaged or invested kind of the organisation.
So are they wrong?
We've agreed with them yesterday that actually we would really welcome them in, and they're starting an assessment process at the end of this before Christmas, and then a follow-up in February 2019. And that's again looking at all of the range of different processes that are in place.
Has the Minister talked to you about the problems you're having there? Has the Health Minister talked to you? Or have you talked to the Health Minister?
No, we've kept the Health Minister aware of the issues and challenges sitting here.
What's he said to you about how you're doing? Because it doesn't look that good when you see that list of horrific injuries. So what's he said to you?
One of the challenges with mental health services right across the country is how we're collectively dealing with an increased range of complexity and also an increased number of assaults. Now, one of the challenges that we have, that I've touched on, and that is unique to the Canterbury component, is the sheer volume of increase has actually stretched and overflowed most of our services.
So do you need more resources and money? Do you need more resources and money? You're talking about an escalating problem here, and you're trying to cut your cloth to fit. So more money? Do you need more money?
No. So there is both additional resource and we've got some significant facility challenges that are sitting there. But the bigger issue is actually there is not a whole lot of experienced mental health nurses that are sitting there waiting to be employed. We have just about got all of those employed, and we have had a strategy over the past quite a number of years of bringing in a lot of new graduates and providing an enhanced level of support for them. Now, that is part of actually how do you deal with actually a workforce shortage required for a very, very specialised service. And I would love someone in the country to wave a magic wand with a whole range of experienced mental health nurses. And that's been one of the issues and challenges, less at the moment about resourcing, but actually being able to find and employ the experienced nurses.
And did the Minister offer you any assurances in that respect, whether he can do anything to assist?
In terms of, you don't turn around these issues that have actually been in the making for many, many years, and in the Canterbury context has been compounded by actually the impacts of New Zealand's largest natural disaster. It has had an impact that is actually very different from any other part of the country. And part of that is how we continue to deal and face and meet those challenges into the future, as well as dealing with the issues of now.
That is David Mates, the boss of the Canterbury DHB. Thank you for finally joining us this evening. Much appreciated.